Hey everyone, welcome back to the Original Medicine Podcast. My name is McCullough and I'm a classical Chinese medicine practitioner. Today's episode is going to be fairly short and sweet, but I wanted to talk about things that run in your family and how acupuncture can be used to actually stop that cycle, as well as obviously treat the problems that you're having as a result of that inherited condition. So the reason this is most important to hear is that if you are looking for acupuncture support for something that runs in your family and now you have it, this is not something that you want to seek out TCM acupuncture for, because what TCM teaches are the primary channels. They don't necessarily teach the channels to be utilized as a channel. They're teaching points on primary channels, but the classic texts tell us that those channels simply cannot reach the level of energy that is affected when we have something that runs in our family. So to back up, the Chinese medicine system looks at the body in levels of energy. So from exterior to the deepest level interior, okay? And that deepest level interior is what we call the yuan level. You don't have to get caught up in the names or anything, but just know that that deepest level has a name in Chinese medicine because it is significant. And all levels of energy are important and useful. But the most important thing when you're looking for acupuncture treatment, whether you are a patient or whether you are an acupuncturist looking to deliver treatment, is that we've got to make sure that we understand what level is affected in the body and what level is our treatment targeting. And so the mismatch in present day comes when acupuncturists believe that they are able to treat the deepest level of the body using the same points and the same needling techniques that they use for other conditions. And what I would take a step farther and argue is that there is so little emphasis on this in school outside of herbal medicine that I don't think that a lot of people go into practice really thinking about how their needling affects the layer of energy that they're treating, the level of energy that they're treating, just because it doesn't really register, because I don't think schools are emphasizing it. Some acupuncture schools don't teach herbal medicine, and then some teach it, but it's not required. So it's an option. Like, does a person want to study it or not? I think that this is a tremendous miss, because in herbal medicine, you get more into the depths of energy, and you're talking about whether it is like an exterior condition. So this means like the common cold. There's like a whole classical text written on how cold damages our body. And in that text, it talks about how it moves throughout the body deeper, 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 if we're not fully resourced and we can like push that problem out. So what I'm trying to say here is that if your acupuncturist has gone to a school that has not taught them herbs and they have not done the kind of training that I'm talking about here, they're just not going to have that reference point for when I needle, am I needling to a level that is affecting the level of the body that I want to affect? Because 8 extraordinary channels are absolutely mentioned in TCM schools, but the way that they're taught is such a watered down version that I don't think it gives us acupuncturists a good understanding of how to actually utilize them. So prior to the Cultural Revolution, acupuncture was practiced as a series of channels, and it was understood how pathology moved through the body. Somebody gets a common cold, and then many years later, they have arthritis, okay? That is because of the way that pathology, that virus that caused a cold, moved through the body, and the body held on to it, put it deeper into the body, and then many years later, they have some sort of chronic condition that also involves the joints, okay? This is just one example of how Chinese medicine sees the body's response to any given problem. It's going to try to tuck it away, put it somewhere else if it can't get it out. But when it comes to acupuncture, and in acupuncture schools, people are not taught to think about what level of the body. So if you have not learned the herbal side of Chinese medicine, you really just don't have a reference for what actually is happening here. To get into it a little bit more, if you have something that is bothering you that runs in your family and you're looking for help through acupuncture and Chinese medicine, you're looking for somebody who practices the complement channels, because something that runs in your family is an 8 extraordinary channel problem. This is where we get into DNA, we get into obviously inherited things, we get into epigenetics. And so obviously not everything that runs in your family will go to you, but if it has and you're looking for help with it, this is what you need, an 8 extraordinary channel treatment. And we need that treatment to be focused on the channel itself, not points. So in school, it got watered down when the Cultural Revolution happened and TCM was created. It got watered down into what they call master and couple points. And so these would just be 2 acupuncture points. But nothing that I've ever seen in school or even in continuing education classes outside of my teacher and Cecil Sturman has ever focused on the needling technique. So there is another somewhat popular teacher who is teaching 8 extraordinary channels. Specifically, I have her book, and people will even tell me, oh, I've taken her complement channel classes, but yet they don't understand what we're doing with the channel, because I just think like that's missed in that arena. And so you may or may not know that I offer remote treatments, which might be interesting given that I've just been talking about how the needling is very important in this type of treatment in order to get the result that you want, in order to affect that level of energy. But remote treatments are all about intention, but in-person treatments with needles are also about intention. And when we use the needles to place into the body, we are using those as a way to focus our intention, to focus the patient's intention. When something feels uncomfortable, what does it do? It focuses your attention on that discomfort, right? So the modern day practice of practitioners using silicone coated needles with plastic handles, they slide right into the body. You literally do not even feel them. I think that's a travesty, because you've completely taken away so many of the elements that apply to an acupuncture treatment, focusing the energy. I'm also not saying I'm trying to make anything hurt for people, but I do think that there should be a sensation when you are getting an acupuncture treatment. And I don't think it's a bad thing when patients say, ooh, or ah, or oh, that feels really uncomfortable, or that hurts. I don't necessarily think that that is a bad thing, because it is calling their attention to something and it is inviting them to change. So the same thing is true when we're doing remote treatments. The intention is to affect that deep level of energy. So in my mind, when I'm doing a remote treatment, I'm thinking about that deep level of energy, activating that in myself, and then transmitting it to another person. Now, sometimes people say, oh, that feels really heavy, or it feels deep to me. And then sometimes people say, no, I don't feel anything at all. But the next day they email and say, oh, this feels different, or this is improving, or this happened, right? The treatment is having an effect whether or not they feel it in the moment. And so back to the needling thing, I do think that that is possible if your intention is there, meaning essentially that I don't think it's the needles that are doing the thing or not doing the thing. I think it is the intention. But if we as acupuncturists have never learned to focus our intention on that deep level and on the channel versus points, then we can't get you, the patient, the results that you're looking for, which is to address an inherited disease. So if your mom had endometriosis and your grandmother had endometriosis and now you have endometriosis, that is not something that you are going to effectively address at a TCM acupuncturist office, simply because what TCM is using the primary channels. And the primary channels are not where an inherited problem lies, okay? So this would be similar to someone giving you geographic directions to drive somewhere and you just like disregarding them and taking a completely different highway. There's always more than one way to get to a destination, but there are some roads that simply do not get you to the destination. If you travel west when you really need to go north, that is not going to get you to your destination in the north, okay? And this is my best analogy for what is happening when you go to an acupuncturist for an inherited condition and they're using primary channels. It's like going west when really you need to go north. It's not going to get you to your destination. Now, it may help a little with your symptoms, but what I'm always gunning for is true healing. Like, I don't want to just manage your symptoms. I'm not looking for it to just get a little bit better. I'm literally looking for you to never need me again. I want to work with you on the level where your problem is so that you don't have that problem anymore. And there are lots of practitioners like myself. And a good way to find people that have studied the complement channels with Ann Cecil Sturman is to go to her website, and she has a list of people that have taken the mentorship. Now, there are a lot of factors that go into whether someone truly uses these in their practice, how they're using them. But the thing that's important to know is that acupuncture is not all the same. All practitioners aren't the same. And if you've gotten acupuncture before and not gotten the help that you needed, and you're realizing now when you're listening to this, oh, yeah, well, like this is inherited, it runs in my family. Like all these people before me had the same problem too. That's something you're really going to need a practitioner who understands the levels of energy to help you with. And we are out there. You can find us. And again, like I said, even if you're not in my local area, I do remote treatments and people get really amazing results. So I know sometimes that can be hard for people to wrap their minds around, but I think Reiki is really commonly understood. So if you think about something like Reiki, but then utilizing the channels of Chinese medicine, it's like a combination of the ideas. And I wrote a Substack article about this very thing. Like I was saying earlier, if we don't understand the level at which we're working, I don't think it matters whether we're in person or whether we are remote. I don't think that it will be effective. So if you are in person with an acupuncturist who does not understand the levels of energy and how the intention of their needling should be adjusted for the levels of energy, I think you probably can't expect to get good results. I think you can expect to have symptoms perhaps managed and maybe improved a bit, but I don't think you're going to really change what's happening in your body. Perhaps I should have said this at the beginning, but I really think of the 8 extraordinary channels like the foundation of a house. That when you have problems, like let's say with the siding, or there's like a piece of the roof that is like always leaking or it's not quite right. And so you have contractors come out and you fix these little things here and there, but you've disregarded the fact that the foundation is the problem. You're going to keep fixing those little things over and over and over until you address the foundation. And so for me, in the way that I practice, in the way that I've been taught, and just the way that I conceptualize things, there are a lot of symptoms that can be linked to other levels of energy for sure. And that is the tricky part about practicing Chinese medicine, because if you just base your treatment on symptoms, then you run into the situation of you might be treating at the wrong level. But if you really diagnose using a really thorough discussion and even more importantly, pulse diagnosis, then you're getting into exactly what the body is showing you. And what I personally see a lot in my practice is that something that I think could have easily fit into another level of energy, when I feel the pulse, I feel an 8 extraordinary pulse. So that tells me that for many, many people, the problems that they are dealing with in their health, whether that's physical health, mental health, or, something in between, or a combo, of course, is part of the 8 extraordinary. So if we treat the 8 extraordinary, in my mind, I think of it like making the foundation of the house more solid and correcting whatever problem is there. And then if we still have symptoms, knowing that we've already shored up the foundation of the house, then we can fix that roof and it's going to stay. It's going to hold. We can fix the siding. It's going to hold. The window will always open once we fix it again because the foundation is right. So hoping that gives you something to think about. Please give this podcast a follow, if you will. I appreciate you listening so much, and following really helps boost it in the whole algorithm situation. If you have comments or questions, if there are topics that you want me to cover, please reach out on Instagram, Dr. MG McCullough. I really love talking to people about Chinese medicine. I genuinely love practicing, and I want more people to know about the medicine and how to make the best decision for them, because I know so many people have chronic and or sort of odd symptoms that push them to seek out acupuncture. And then when they don't get the results that they want, they feel understandably disappointed. And so I think getting more information out to people about the differences and what you can expect and what you should be looking for is really important to me, so that people have more information to make their decisions. So thank you so much for listening, and I'll see you next time.